For Mildura.
Thank you, Acting Speaker. It's a pleasure to rise today to make a contribution on the Safe Patient Care Amendment Bill. Health services are one of the key platforms on which I was elected as member for Mildura in 2018, and it's a particular issue I've spoken about several times in this chamber, and I'll touch on again in a moment. It's hard to separate health services from nurses. They are the backbone of our hospitals, community health services, and maternal and child health services. I support wholeheartedly any move that seeks to strengthen the role of nurses, midwives and maternal and child health nurses. It's of note that Victoria was the first state in Australia to legislate minimum nurse and midwife staffing levels with the passing of the Safe Care Act in 2015. This landmark act arguably provides for the most detailed guidance on the provision of nursing services anywhere in the world. Given the ever-changing nature of public health and hospital services, it makes sense that such an act requires regular updates to keep pace with new realities and challenges that evolve over time and which nurses face on the ground every shift. This bill and the Safer Care Act, which it seeks to amend, are a perfect example of unions and government working together in the interests of patients and the entire community. The government support for nurses in Victoria is the envy of the nation. Both the government and the Victorian branch of the Australian Nursing and Midwifery Federation should be commended for building a strong and constructive relationship that has resulted in a sound evidence-based approach to policy, and we are all safer for it. When I speak of evidence, I refer to the research that shows that higher staffing numbers lead to a more engaged workforce and better patient outcomes. Any of us who have experienced as patients or visitors to a hospital will know the difference between care from a nurse who is run off his or her feet or overloaded with patients, as opposed to the nurse who works in an adequately staffed ward. But it's not just personal experience that tells us this. The research evidence backs it up too. For example, a randomised controlled trial that was conducted in Belgium just last year and published in BMC Health Services Research confirmed the association between higher nurse staffing levels and lower patient mortality. Similarly, Professor Linda Aiken from the University of Pennsylvania, who is considered to be a world authority on nurse-to-patient ratios, found in 2002 that every extra patient per nurse over 4 patients is linked with a 7% increase in the likelihood of the patient dying within 30 days of admission. Since Victoria first introduced nurse-to-patient ratios in the year 2000, the impact on the quality of health services has been noted, with a 151% increase in patients receiving same-day treatment and a 20% increase in urgent and semi-urgent elective surgeries across the state. The nurse-to-patient ratios that have existed since 2000 and were enshrined in law in 2015 have been implemented and adhered to at Mildura Base Hospital, the largest hospital in my electorate. But the nurses and frontline staff have had to endure, for 20 years, challenges of a different kind, and that's been working in a privatised hospital environment. I listened with interest yesterday as the member for Ivanhoe spoke in this chamber about the Kennett government's attempt to privatise the Austin Hospital in the late 1990s, a process that the newly elected Bracks government, I believe rightly, stopped in 1999. Unfortunately for my electorate, we were not so lucky and the Mildura Base Hospital was privatised. What this has meant for the good nurses of Mildura Base has been working in an environment where where making a profit was a central priority, where man hours, as they're known, are a management priority that take precedence over other elements of patient care, where service provision is seen as a loss to the bottom line rather than an opportunity to provide outstanding care. It's a situation that, as the only privatised hospital in Victoria, has seen Mildura Base Hospital languishing in the far corner of the state, separated from the Victorian public hospital network. And I believe that the nurse-to-patient ratios enshrined in law in 2015 and first implemented in 2000, according to good authority, were a thorn in the side of the hospital's operator in their unending quest to maximise profit. What we saw in response at Mildura was a hospital that implemented a range of other cost-saving measures with vigour, not commonly seen in public hospitals, such as replacing 8-hour shifts with 6-hour shifts, misrepresentation of the number of permanent beds in a given unit, an over-reliance on casual workers rather than permanent staff to avoid having to pay leave and other entitlements, and a tendency towards part-time over full-time staff to avoid having to provide acquired days off to employed staff. But times have changed, and late last year I stood with the Premier and the Health Minister, very proudly, at the front of Mildura Base Hospital while they announced that the hospital would be brought back into the public system. The wrong that was done to Mildura in privatising our hospital is finally to be made right, thanks to the government, and on the 15th of September 2020, the nurses who are the backbone of our hospital are to rejoin their colleagues right across Victoria in working for a truly public hospital. I'm sure it won't be the last time I talk about this win here in the House, and I need to once again congratulate the community members of Mildura who fought so hard for this change, many of whom are nurses, who put their jobs on the line in the fight to have our hospital put back where it belongs, in our hands. I will be celebrating with all of our nurses on September 15. I would like to finish today by touching on another aspect of the bill, which is the amendment to the Child Safety and Wellbeing Act 2005, which prescribes maternal and child health qualifications into the legislation. I know firsthand from friends of mine who are maternal and child health nurses just how passionate they are about their field of expertise and how proud they are to be not just maternal and child health nurses, but Victorian maternal and child healthcare nurses. And so it should be that their pride, expertise and qualifications should be enshrined into law for the benefit of us all. I commend the bill to the House. Thank you.
The member for Burwood.
Well, thank you, Acting Speaker, and thank you to the member for Mildura for her contribution. I wish only that it had been 3 minutes longer so that I might have sprung to my feet a little bit more promptly. However,